All right. Well, good afternoon, everyone. As Jackie said, it is morning in Colorado where I am, but happy to be speaking with you from Denver. And as Jackie mentioned, I am the Healthcare Program Director with Greener by Default, which is a US-based nonprofit that consults with institutional food service. And so today I'll be just sharing a little bit about some of the evidence-based strategies that we use for cultivating sustainability by default. And just a bit about my background. As Jackie mentioned, I'm a public health dietitian. My work has been in public health in the chronic disease prevention aspect, but currently really focused on the intersection of nutrition and climate change mitigation and food systems. So a little bit about Greener by Default. Our mission is really simple. It's flipping the norm to make plant-based the default and giving people the choice to opt in to meat and dairy. And in addition to working with hospitals, which is my main role, we also partner with large corporations, university dining, and conference and event planners as well. And so before I explain how all this works, I just want to spend a few minutes explaining why we are focused on plant-based foods. So just a bit about the issue. You know, we tend to think about cars and industrial smokestacks when we think about threats to the environment. However, our current food system poses big dangers to the planet. And many of those dangers really come from one part of the agricultural sector. You know, globally, animal agriculture uses 77% of all farmland, and it produces 57% of all food-associated greenhouse gas emissions, but only produces 37% of the world's protein. So the upshot is that plants are providing most of the protein, while animals are producing most of the emissions. In addition, another related issue is that much of the world's antibiotic supply is used to promote growth in healthy livestock, which is really contributing to antibiotic resistance, according to the World Health Organization. And here is a graph that you can see how some different protein sources compare in terms of greenhouse gas emissions. So the most carbon intensive foods are animal products, with beef, lamb, and cheese that are on the left side of this graph, contributing the most emissions per kilogram of food. And then plant-based foods are on the right with the smallest carbon footprint. Oftentimes when we're working with food service, people point to chicken as the sustainable choice and the solution to the emissions issue. And while that is true that chicken has a lower carbon footprint than beef, it's still 7 times greater than those of plant-based proteins like lentils and beans. And many peer-reviewed studies have also found that we really can't keep climate change under control if we continue our diets as usual. But not everyone's talking about this. So the fact is, though, that if the food system were to remain as it is, while every other sector, including energy, transportation, and our buildings, became completely carbon neutral by 2050, emissions from the food system alone would still take us over the Paris Agreement goals. And then on the public health side, the food system and our modern diets are also at the heart of many public health issues. We know that half the risk factors that are associated with the highest number of deaths worldwide in 2019 were directly related to dietary choices. And then there was also another study that was in the Lancet as well that noted that poor diet's effects on mortality now surpass that of cigarette smoking. And then, you know, much of this diet-related illness is really hitting historically marginalized groups the hardest. And poor dietary choices are also so expensive. They are accounting for a very large portion of healthcare costs and government spending. So what's the solution, or a solution? We feel that there's some good news, and that is that eating and serving more plant-based meals is a critical strategy for reducing emissions while also improving health. So on average, plant-based foods have half the carbon footprint of animal-based meals, and they're also associated with significantly lower risk of many chronic diseases. Plant-based diets definitely have encouraging health benefits. So for example, there's a lot of studies, there's a really strong body of evidence that have found that higher adherence to plant-based eating patterns is associated with lower risk of several diseases. And there's also a lot of increasing evidence that plant-based eating may offer a protective effect against Alzheimer's and other dementias, according to the Lancet Commission on Dementia. And there is also research that suggests there's a dose-response effect. So the more plant-based a person's eating pattern, the greater the reduction in health risks, especially when, depended on the study, but especially when those dietary patterns are including plenty of whole plant foods. But even so, when they included some processed foods like meat alternatives, there was still a great reduction in health risks. So I think the main takeaway here is just that you don't have to be completely vegan to reduce your risk of different chronic diseases, but you do see more benefits as you eat more plants and fewer animal products. So for individuals that are looking to improve existing chronic conditions and risk factors, controlled trials with plant-based diets have shown significant reductions in key indicators like the ones listed here in interventions as short as 1 to 2 months. And plant-based eating patterns have also been found to be more effective in improving those measures than specifically tailored eating patterns like the dietary approaches to stop hypertension diet or the DASH diet, or the standard diabetes diets. So plant-based diets do definitely have some significant research behind them at this point, and it's still, the evidence base is still growing on that. Within healthcare settings in particular, there's really good evidence suggesting that plant-based eating patterns can reduce both short and long-term healthcare costs and decrease medication use and healthcare utilization. There's also some emerging evidence that plant-based eating patterns can reduce readmission rates, which I'd love to see even more research on that. So just briefly, I wanted to touch on the nutrition of plant-based eating patterns. According to the British Dietetic Association and many other medical and nutrition professional groups, plant-based diets can improve health outcomes and are supportive of healthy living at every age and every life stage. Many plant-based diets can be higher quality than that of standard diets because plant-based foods provide plenty of protein, fiber, phytonutrients, and they're often higher in nutrients that many people are considered deficient in, including magnesium, potassium, and vitamin C. There was actually in 2021 a review of over 140 studies that compared the diets of vegetarians and vegans with meat eaters, and what they found was that although there were still some nutrition inadequacies across all of those dietary patterns, but the conclusion of this large meta-analysis was that since plant-based diets are generally better for both health and the environment, public health strategies really should facilitate the transition to a balanced diet with a more diverse, nutrient-dense array of plant foods. So thus, plant-based meals really that a patient may have during their hospital stay are great exposure to what it looks like to follow a healthier and more sustainable dietary pattern. And having more plant-based menu items can offer patients a variety of foods that are really good for their long-term health, as well as being fully nourishing, appetizing, and also culturally appropriate while they're ill and recovering in hospital. So how do we encourage that shift to more plant-based eating? Our work at Greener by Default was inspired by behavioral economics, and specifically this book, Nudge, which examines the impacts of defaults and nudges on human behavior. And when we talk about defaults, what we mean is the option that people end up with if they don't make an active choice for something else. So, for example, um, many people's phones have the same ringtone, the default tone that they came with when they took them out of the box, because people don't always go in and choose to go through the settings and change it. It's just one more thing to do. So sticking with the default is still the case for many people's phone ringtones. And as the authors explain, people tend to just stick with the default because it's just, the status quo. It's one less decision to make, and often because defaults are seen as more socially acceptable. So when you combine plant-based foods with defaults and nudges, you get greener by default. And our concept is pretty simple. We are facilitating healthy, sustainable choices by flipping the norm. And currently, almost everywhere you go, meat and dairy are the default choices for most meals. And if you want something that's plant-based, you have to opt into that, which usually only vegetarians or vegans are going to put in the time and energy to do. But we're working to change that by making plant-based the default and giving people the choice to opt into meat and dairy. So this way, everyone still has complete freedom of choice. The meat and dairy are still on the menu, but the more sustainable, health-promoting option is the default. It's also pretty flexible because it can be implemented in any environment where food is served across a range of cuisines and dietary preferences. And it's also cost neutral, and it can even save money. This approach is also more inclusive, which is, I think, another strong argument for greener by default strategies. You know, when people have specific dietary needs, having to request special accommodations rather than just enjoying their meal can be alienating, and sometimes it takes extra time. But if you serve plant-based foods with the option to add meat by default, or add meat and dairy, that includes everyone by default. So um, it does include those with food allergies, um, the prevalence of which has been increasing. And we know that roughly 2/3 of the global population is lactose intolerant, and the majority of those are people of color. So this is definitely more inclusive of many populations. It also includes those that are practicing religions that encourage vegetarianism, or those that don't eat pork or keep kosher. And it includes many communities of color. The global prevalence of vegetarianism is now estimated at over 1.5 billion people. So how do we know that this works? There's actually quite a few studies that show that default in food service are very effective. This is showing a study that we actually conducted with some researchers at a number of different universities in the US, including the University of California, Los Angeles, and Harvard. And this study looked at the impacts of a plant-based default on meal choice at catered events. And so what you're seeing here is in the control condition that was on the left, it was found that when meat was the default and people could request a plant-based option, less than 20% of people actually did that. So they didn't have a very large uptake of plant-based meals. But when the plant-based was the default, as shown in the circle on the right, and people could request a meat meal, on average, actually 2/3 of people stuck with that plant-based default, and 1/3 requested a meat meal. So that's a really significant increase in the number of people eating plant-based meals without taking away any choices, but just simply by switching the default. You can also think of those study results similar to this graph here. So on one side, you have the vegans who are going to go out of their way to request plant-based food. And on the other side, you have more of the hardcore meat lovers who are going to go out of their way to eat meat at every meal. But most people actually fall into this middle category of flexitarians. And these are people who aren't going to go out of their way to request plant-based food, But on the other hand, if it's presented to them and it's delicious, they're happy to stick with it when it's the norm. And that's really the focus of our work. All right, so what does this actually look like in practice? Next, we'll just talk about a few different strategies that can be used to implement plant-based defaults in different types of food service settings. So the core strategy is plant-based defaults, and the idea here is to make the base of a meal plant-based and then give people the choice to opt into meat and dairy. So in a staff canteen or a cafe, you can offer plant-based entrees first with meat and dairy at the end of the serving line. And that way people will naturally fill up their plates with plant-based foods and then be using the meat and dairy as more of a garnish or an add-on rather than the bulk of the meal. Alternatively, if people are choosing from a room service style menu in a hospital, you can make the base entree plant-based, including protein, and then you offer meat and dairy as add-ons. So this is pretty common practice already for salads and bowls at many restaurants, where you might have a base that's veg, and then you pay a little bit extra to add on grilled chicken or fish, for example. And plant-based meals also work really well as a default in hospitals that offer a cycle menu with just a limited number of choices. So there's different applications depending on the menu and the food service operation. In addition, we've also found it's really helpful to implement a policy of providing plant-based meals by default for late trays, or that when patients are away from their room when someone comes to take their meal selection. So another strategy that we often use when it's not possible to make the base of the meal entirely plant-based is to create the impression or the perception that plant-based is the default by offering a minimum ratio of 2-to-1 veg to meat options. So a recent study actually found that when menus shift from having 2/3 meat options to 2/3 vegetarian options, selection of those veg meals increases by 56%. And I think that's really because when there's only one vegetarian or plant-based option on a menu, omnivores perceive that as the special option that's just for the vegans and the vegetarians. So if I don't follow those diets or identify as a vegetarian or a vegan, I might think that's not for me. But when we shift the ratios and you're providing several different veg options, what we're really doing is shifting the decision-making process. So now people are thinking more about, do I want those black bean enchiladas or the chickpea curry or the pasta primavera? They're thinking more about the flavors and what they're in the mood for that day, rather than whether they identify as a vegan who would go out of their way to avoid meat. And next, what we call subtle substitutions. Is this another easy strategy? And this is really just serving plant-based condiments, milks, desserts, and breads by default. And this is more inclusive because it meets the needs of those with allergies and dietary restrictions. And nowadays, plant-based products are really so good that most people won't even notice the difference most of the time. We did work with one university that was trialing a vegan brownie, and what they found was that students actually preferred the taste of the vegan brownie to the conventional one. And at the same time, the vegan recipe had a lower carbon and water footprint, and it allowed more students to enjoy them. And it was less costly and lower in saturated fat because they were using oil instead of butter. So it was really a win-win-win. And another quick example of just how impactful these small changes can be. There's a school district here in Colorado where I live that replaced all dairy and eggs in their baked goods with applesauce and oil. And they saved emissions equivalent to driving over 50,000 miles, as well as significant cost savings. And the other great thing for in their case was that their budget and their supply chain are not subject to those seasonal fluctuations that are resulting from avian flu outbreaks or higher egg prices. And I'm not sure if that's as much of a concern in the UK, but definitely something that we've seen a lot of in the US in terms of the avian flu and the egg price changes. So our next strategy is restructuring menus. And so when there's a printed menu, or it could also be an on-screen menu, you want to ensure that plant-based options are incorporated into the main menu rather than in a separate section or a separate menu even. And this simple change can also increase selection of plant-based items by over 50%. That's really because, again, if I'm an omnivore, I'm looking at the menu on the right-hand side here. I see the vegetarian section at the bottom and I think, well, that's just for the vegetarians. So I'm not going to even look at that because I'm not a vegetarian. But if the veg options are incorporated into the main menu as shown on the left, and especially when they're listed first and throughout the menu, I'll choose what sounds delicious. So if that risotto catches my eye and sounds good, I'll order that, and I might not even notice the fact that it's plant-based. And another impactful strategy that we often use is labeling foods with names that are really focused more on taste and texture and provenance, rather than calling them vegetarian or vegan or meatless or even healthy. And as a dietitian, it pains me to realize that most people still think that healthy means less delicious and less filling. The same goes for calling items vegan. Some people think that vegan means it's got strange ingredients, or others, again, they just think it's only for the vegans, so they're not giving it a second thought. And another way you could think about this is if you were to imagine a menu that offered something called a celiac bowl. You probably wouldn't order it unless you had celiac disease or another reason to eat gluten-free. But at the same time, if you saw that same menu and it had something called a Thai peanut rice noodle bowl, you might order it because it sounds flavorful and filling, and you wouldn't even think about the fact that it's gluten-free. So the same framing also goes for plant-based items. And we found another great example of this when we worked with a staff canteen at a software company, and they changed the name of their vegetarian hummus wrap to roasted red pepper, avocado, and hummus wrap. And after the name change, they immediately saw sales increase without changing anything about the actual food itself. So those names can make a difference. All right, so next I wanted to look at a couple of case studies where we've implemented these strategies with hospitals. So New York City Health and Hospitals piloted plant-based defaults for patient lunches. And the way they do this in their operation is they first offer patients 2 plant-based chef specials. And then if the patients decline those, they're offered some animal-based dishes, or the rest of the menu, which includes both animal and plant-based dishes. So in the pilot, what they found was that more than half of the patients selected one of the plant-based meals, and 95% of those patients were satisfied with their choice. So over time, actually, the patient satisfaction has remained very high. It's still over 90%, and they are in their second year of doing this. And so the pilot was so successful that they have now implemented the defaults at lunch and dinner at all 11 of their hospitals. They are saving an equivalent of about 0.4 million pounds annually. And they also cut their carbon footprint by about a third. So next, I'd like to actually share a short video about New York City's program, which really sums up why we do this work. So let me know if you can hear this.
most communities of colors, we suffer from high levels of diabetes, we're dying from hypertension, we're dying from so many cardiovascular diseases.
When it comes to a meat-based diet, we typically will see an increase in blood cholesterol, in high blood pressure, and overall weight management.
What we really ought to be doing as healthcare systems is to address some of the root causes of these chronic diseases. Our mission at Health and Hospitals is to leverage one of the most powerful tools we have, and that's nutrition. And so what we're planning to do is incorporate nutrition into the fabric of the care that we provide.
No one likes having something forced onto them or feeling like they're having their choice taken away from them. So in New York City Health and Hospitals, they have initiated a really ground program where patients choose from different meals, but the two chef specials of the day are now always plant-based. And then if they don't want those, then they have a variety of meat options to choose from. So with the default approach, you keep everyone happy because everyone has the options that they want or need. But again, it's nudging people towards the more sustainable plant-based options.
Food is good. I like the vegetable, and the vegetable is good for health.
So when we're developing menus, what we look at, number one, is the cultures that we feed. We look into our communities, the foods that they've grown up on, things that they might make at home. And we take that approach, we just make them healthier. Meat proteins have fat, they have that umami flavor. So we try to do that with vegetables. So by roasting them and getting the natural sugars out of the vegetables and caramelizing them, it really makes it exciting.
As a registered dietitian, being able to provide that patient with the amount of calories that they need, the amount of protein, and making sure that we're meeting all their micronutrient needs through a plant-based diet has really been eye-opening. It's not as hard as it appears to be.
I thought it was going to be more difficult. We're getting a really good feedback from our patients. Some of the people actually said to me, this reminds me of my mom's sancocho. I know there's no meat in it, but it was really delicious.
Eating healthy is not just for the wealthy. It's not for the well-educated only. It's also for me and you and our community.
All right, so that's just a bit about our work in New York. And then another case study I wanted to share briefly is we are also just wrapping up a project with Vancouver Coastal Health in British Columbia, Canada, on a large planetary health menu pilot. And that really emphasized low carbon protein sources for lunches and dinners, as well as locally sourced foods. So they offered a plant-based default meal to most patients, at least one meal on most days across their 2-week menu cycle. And additionally, because they took the step of removing most beef and pork from their menu, they were able to reduce greenhouse gas emissions by 42%, which is really good results. And one of the project goals here also was to increase patient satisfaction with meals. That was a metric that they felt was lower than they wanted to see it. And so they really achieved this through adding more culturally relevant and diverse foods, as well as really working on those recipes, tweaking them, and retesting a number of times to ensure that the food is delicious and as close to restaurant quality as possible. All right, so let's just touch on how these ideas could work where you are. Here are a few other potential benefits of implementing some of the greener by default strategies beyond just the health benefits. So plant-based meals can definitely allow for more streamlined menus in many cases and reduce the need to stock specialty ingredients and ready-made meals that are satisfying different dietary needs, and that may reduce food waste. In addition, plant-based foods emit far less greenhouse gas emissions than animal-based foods while they are decomposing. So even if you are wasting some of them, it's less emitting than meat-based food waste. And then with the recent cost or price fluctuations in foods like poultry and eggs due to avian flu outbreaks, reducing the purchase of those items can help protect the catering department budget from large and unpredictable changes. And food safety is another aspect of this. And I will just say, you know, food safety applies to all foods, and that's still a critical piece of food service operations. But we also believe that reducing the amount of high-risk foods such as raw or undercooked meat, poultry, fish, seafood, eggs, all of those things can help lower your hospital's risk of foodborne illness. And plant-based foods may also have a lower risk of cross-contamination during preparation, and they have a lower amount of harmful pathogens like Listeria, which are commonly associated with animal products. Now, in terms of emissions reductions, you know, food is actually 10 to 12% of all hospital emissions. And so that's a huge chunk that you could really impact with some changes to the menu. And in terms of those reductions, these strategies, I think, are easier to implement, and they're less costly in reducing emissions compared to many other type of sustainability interventions, such as, you know, buying an electric fleet or installing solar panels, and, or other sustainability interventions that may have more upfront costs. And they're also even more effective than using local suppliers of food. So it's more about what is the food you're buying rather than where it's coming from. And if you're making changes to a menu for hospital staff, such as a staff canteen, plant-based foods can really improve the quality of the calories that staff are consuming there. And they can also help prevent and manage chronic diseases, which may reduce overall staff healthcare challenges, as well as the use of sick days. So you may be thinking that if you're not a food service person or a nutrition person or a dietitian, this might be out of your swim lane. But I think we need allied health professionals from many different disciplines to support this kind of transformation. And here are just a few thoughts on how you could be involved or help support bringing more sustainable and inclusive plant-based meal options to the menu at your hospital. And in just a minute, I'd love to hear more about your thoughts on this too. But a few ideas are just to first think about how sustainable, inclusive plant-based meal options could actually benefit your patients in terms of chronic disease management and maybe symptoms or side effects management. There's a lot of benefits there, but not one is just to think about the fiber. So many benefits coming from increased fiber in our diets. Also advocating with leadership in your practice area and throughout the hospital and the trust. You know, it could also be for plant-based meal options for staff. Sometimes that's an easier starting point, and then moving into a patient menu from there. But really just, you know, being an advocate for these kinds of changes, and connect interested stakeholders. You know, you can be a catalyst for change by connecting with or connecting those who are passionate about sustainable food. One thing I do want to also just mention is the food service staff. They really need recognition, especially for their efforts during some kind of operational or menu changes. That's a big change for people, and food service staff already don't receive enough recognition for their work, and they will very much appreciate your support. And if your hospital is embarking on adding more plant-based dishes to the menu, there may be opportunities for you to attend a tasting event for new menu items and try that food yourself. And then you're able to tell patients how much you enjoyed the food, and that will actually increase their willingness to try it. So those are just a few ideas for your consideration. Here are my contact details, and please reach out if you'd like to explore partnering on a pilot project. Our website's also here for more information, and I'd be very happy to answer any questions about our work. So I will stop there. And Jackie, I'm not sure if you wanted to review anything here, or if we're just going to move into Q&A.
Thank you so much, Heidi. There was a lot of information there, really useful and really interesting. It's so interesting, isn't it, that you just change things around on a menu and it changes behavior so effortlessly, apparently effortlessly. There's some comments about how fantastic work it is, and lots of claps I hope you saw, but I just wondered if anybody's got any questions they want to ask. If you want to turn your cameras on and ask questions, or somebody's got their hand up. Shireen.
Oh, hi there. Thanks ever so much, Heidi. You've been following your excellent work and have chatted to other members of your team. So thank you, and really grateful for you to hear this across the UK audience. I mean, I personally would love to do what you're doing, but we seem to have so many barriers. And I guess it's more comments for the rest of the audience, who I assume are dietitians. I'm not a dietitian, I'm a medical doctor, so really an advocate rather than somebody who can possibly make the final change. I'm at King's College Hospital. We've been trying to make changes for the last 3 to 4 years. We've managed to make some changes with food labelling, increasing plant-based dishes, more inclusive naming of dishes, deprioritising red meat. But I have to say, I'm afraid, apologies to the audience, but it really is the catering dietitians that seem to be my biggest barrier, because they are reluctant to take away the kind of popular meals, which in my hospital are pork and leek sausage, it's a ham sandwich, and so they remain, front and center, and these dishes are popular, so they don't want to risk reduced sort of level of feedback, which is generally okay on our menus. And then worrying about older patients. I'm told that sort of 60% of our patients at King's fall into the sort of undernourished or poorly nourished category, and worrying about exacerbating that when we're not providing them with the food that they might be typically eating. And I guess the list of sort of reasons why we're not doing this kind of go on, but those initial reasons that I've had for at least not even considering taking red and processed meat off menus as a starter, and adding in more sort of pulses and lentil dishes. But maybe you have some comments, and whether you're using meat alternatives in order to sort of replicate. I think I know those answers, but it'd be nice to hear for the group.
Thank you so much for your question, Shireen. And it's an honor to meet you. I actually have your book right here on my desk. So thank you for your work as well. And I've met your sister in Canada as well. So
fantastic.
Terrific to connect the dots. Yes, and unfortunately, I will say too, and as a dietitian, I have encountered similar resistance from some dietitians, not all of them certainly, but sometimes on the efficacy of plant-based eating for different disease states. Other, I guess, suggestions in terms of barriers and things, and I know you mentioned a number of things, so let me know if I'm not covering everything here, but I think, making changes slowly is also very good. I mean, we tend to think, well, this would be great. Let's come in and let's do a 3-month pilot, and we'll just, have everything ready to go, and it'll be all different in 6 months. And the reality is that we need to bring people along, oftentimes in a much more gradual pace, whether it's the patients eating the food or the staff that are serving it, and the dietitians as well. So that's one consideration. The other thing is, I think, just looking at, what is the nutrition of, looking at those nutrition standards, and each hospital may have some variation there, but You know, are there other opportunities, like if they're concerned about a slightly lower protein in a main dish, are there opportunities not fully eaten? And that's regardless of whether it's a meat-based dish or a plant-based dish. But sometimes we found too that, so if a patient has nausea, sometimes the plant-based foods actually are more appealing because they don't have those super strong flavors or smells or odors. You know, and so that can actually be to an advantage to serving plant-based meals. But I think there's also just some fear of, you know, it feels like we're jumping off a cliff and you don't know how this is going to turn out. And so we don't want to put patients at risk. But I think if you kind of take things just, you know, one meal at a time, a few meals here and there, and still preserve those choices. And one more thing I'll just say is that, you know, this patient that they see right now, they're still working with the renal diets and trying to get those to be more plant-based. You know, that's and the health patients also usually don't receive plant-based defaults. They can still have that if they want it, but it's not a default. So, you know, there's different ways to work around it and I think still succeed.
Yeah, that's really useful. Thank you. Really insightful comments. And hopefully we'll be in touch soon for a pilot somewhere in the NHS.
I hope so too. Yes, we're working with a couple of hospitals in London right now that we're in discussions with and hope to start pilots soon.
Perfect.
Great. And there's a couple more questions in the chat. Some of the things you probably have addressed in that answer about barriers to implementation of greener practice and greener initiatives in hospitals, to do with the infrastructure, food managers unwilling to change, etc. And how did you manage these barriers?
The barriers of
did you, if you came across any barriers to implementation for the greener initiatives, like in terms of food managers being unwilling to change? I guess that's similar to Shireen's question about how do you approach dietitians who are saying you won't get the things that the patients need. And somebody else has said, if you have people who have a reduced carbohydrate and higher protein diet, need a higher protein diet, how does this work? Are they able to have high protein diets?
Yeah, and in terms of the barriers that you mentioned initially there, I think, and also to the other question, you know, bringing the food managers along and the dietitians along very early in the process can be helpful, because I can just think of one hospital in particular we worked with where I think the biggest objection of the dietitians was more about the fact that they had not been involved in the beginning of the project, and they were upset about that. And because they have expertise to offer, and you know, we should all be taking advantage of that and bringing that expertise into the project team. And in their case, that didn't happen, and so they put up some more resistance because of just that. But yeah, I think that definitely there are many ways to do high protein diets. I mean, we know that in general, people in the general population are actually already eating high protein diets. And most of the hospital patients, it's not so much about the protein and calorie content of the food that they're eating. It's about how much of it they're eating.
Yeah. There's another question here about ideas about greener alternatives to oral nutrition supplements. For example, the pre-made milky drinks.
Mm-hmm.
Do you have any ideas on that?
Well, there are some brands of fully plant-based nutritional supplements, like Kate Farms is one brand that comes to my mind right now. And so those are fully plant-based. But there's
how do you
also
spell that? Sorry, just so I can write it down.
Kate, K-A-T-E,
AAT.
And then, there's also the possibility of, there's so many ways that you could use nut butters or silken tofu to make shakes, smoothies, puddings, chia puddings that are very high in protein. And I think in general, if you are looking for how to help a patient that's going to have very high calorie and protein needs, they're going to be needing more supplements anyway. I mean, they're not going to get what they need from just their 3 meals a day. They're still going to need those extra supplements, just as they would if they were on a meat-based diet.
So somebody's asked about evidence of plant-based diets and mental health. Is there any evidence about improved mental health from plant-based diets?
Yes, there is. I don't have any studies that I can cite right off the top of my head, but there are certainly, I can see, I have seen a building base of evidence. In general, yes, plant-based eating has mental health benefits.
Do you feel your cameras on? If people want to put cameras on and join in the chat, that would be great. And you'd asked the question about that. Did you want to talk a bit more about it?
Yeah, is my microphone working?
Yes, it is.
Yeah,
Yes.
good. It wasn't working earlier. Yeah, it was really, I work with people with eating disorders, and I just wondered if there was any kind of evidence around that. I mean, it's really good. It was really good. Thank you very much. It was really interesting. But I just wondered if there's any evidence around people with eating disorders and plant-based diets.
Okay, yeah, and you know what? I have not seen that research. That doesn't mean it's not out there, but I have not seen that specific to eating disorders. However, I think I would approach that with some caution, just because in that scenario, you don't want to be thinking about, restricting choices.
Yeah.
And you'd want to still present them, as equal options if you have a choice.
Yeah.
And sometimes those patients don't necessarily get a choice of their meal in all units, but yeah.
Okay, thank you.
There's another question about in what way are hospital caterers helping to prioritise plant-based menu options across all hours and sites? For example, price promotions in staff canteens, food vending machines, and when patient meals are regenerated and not cooked on site, the taste quality of the veg is poor, so there's more waste. I think it seems to be more of a comment than a question.
I think that there are, and that's one thing that we do work with is looking at what is the food service operation and what is the system that's, if it's a cook chill or a cook freeze, if it's a commissary kitchen versus cooked on site, those are all very different things. And that may influence the type of recipes that you would want to use because of needing to have that holding quality. The vegetables themselves, I'll say that's a challenge no matter whether it's a side dish of vegetables that you're serving with a roast beef or whether it's part of a plant-based dish. That's just somewhat inherent to the food service operation. Yeah.
And Khushbu, I think that you had asked the question. Do you want to?
So I'm a catering dietitian in Sheffield, and we work really hard to incorporate plant-based options to our menus, but we're not there on the wards offering the food to the patients, and the ward staff often who aren't trained on the benefits of a plant-based diet don't promote the dishes the way we would like them promoted, and quite often they ask us to just completely remove those options from the menu because they're not popular, but I worry that they're not even being offered in the first place. Did you come about that in any of your pilots?
Yes, and what I would suggest, and I know this takes time and effort, but it's really important to engage all of the different units and the staff on those units as much as possible in this change process. And to the point I've mentioned, like having a tasting event. Several of the hospitals that we've worked with have had what they called road shows. And they just, had a little presentation and a tasting that they took around to each unit and each ward, and really talked about, why are we doing this? Why is this important? How is this going to benefit patients? We're not expecting every patient to love tofu the first time they eat it, but or to love, lentils necessarily. I mean, but just like anything else, if the staff have tried it and they can say, oh, this has good flavors, they're more likely to share about that and encourage their patients to try it.
That's great, thank you. And Ben, did you want to ask a question?
Yeah, and thank you for all the awesome work you've done. It's really good to see everything. Really great presentation. This is a comment rather than a question. Just I was visiting an animal sanctuary in North Norfolk in England called Hillside Animal Sanctuary, and they had what they called an animal-friendly cafe. And when I was talking to them about whether any of the options they had were plant-based, and they kind of whispered, "It's all plant-based." And they had this, they had the menu, spag bowl, all the usual, lasagna, everything, and at the bottom it just said in small writing, "All of our products are suitable for vegans." And they said no one had ever complained. People will get lasagna expecting it to be normal lasagna, and since going there, I've been surprised visiting other animal sanctuaries how many serve animal products. But it was interesting just in terms of the psychology of it. It's not vegan flashing lights.
Exactly.
And everyone was happy with it.
Thank you for sharing. That's great.
Yeah, and I think, I mean, I'm aware that we've run over time because I think people have got so much to say about this, and you've done so much great work, Heidi, and people want to learn from you. But I know that we have to wrap up, I'm afraid. But thank you so much again for your great presentation. And I'm really it's been lovely to see you and to hear everything that you had to say, and I think people have got a lot to take away from it. We've got very positive comments in the chat. I see that that's Peter May, who works for Greener NHS, has said he's shared your website and your work with the Net Zero team at NHS England. So we'll hope that something comes out of that. So
that would be lovely, and I'd love to hear from any of you. Please reach out if there's any questions or anything we can do to help support your work.
That's great. So thank you again, Heidi, and we'll hopefully we'll be in touch, and we'll have a collaboration again soon. Thank you everybody for coming.
Thank you.
Don't forget there's a questionnaire. It'd be great if people have a minute to fill in. It's only 5 questions for feedback. I'm going to put it in the chat. So before you leave, if I can make my screen work, that'd be great. The feedback, sorry. Okay, great. Yes, so if you could fill in the feedback form, like I say, it's anonymous and it takes 2 minutes. So thank you. And I say goodbye. Yeah. And thanks, Heidi.
Thank
Thanks
you.
for-
Goodbye.
Thank you.
Bye.